Welcome back. Our guest, Dr. Emmanuel Abara, urologist in Ontario, Canada, and pioneer and innovator in telehealth, both locally and globally. Dr. Barr, when we left off, you were talking a little bit about the importance of ministries of health, local governments, encouraging physicians who train to become physicians or other healthcare professionals who train from the local community to try and do things to help them stay so that they can help be part of improving the healthcare infrastructure for their community. I think that professionals who leave their community have a lot of connection to their community and would want to help their community, but don't always have the ability to make that move to go back to their community for various reasons, whether it be resources that they need for their families or themselves. What would you say as with your experience having gone to Canada and now being able to help your community in various ways, your village, your town that you came from in Nigeria? What would you say to those healthcare workers that are there training now, or those healthcare workers who are living outside of their communities? What are the benefits you've seen of being able to connect back to your home community or any other rural community? I mean, what are the benefits of doing this work from wherever you are to help someone else in a rural community?
Well, thank you very much. Again, this is going to be a biased answer, being me and not someone else. And I would like, to just apologize for those who may not buy into what I say. But I think from my point of view, it's a good thing to do. And like I said before, it's important for governments and peoples to encourage physicians and healthcare professionals to practice where they would want to practice in the communities they train, and providing opportunities and resources will make them stay. And in fact, creating these opportunities by adopting technologies that are currently available would also be important to make them to stay. Making sure that they are funded. Most people who leave or who try to leave is, if you're owing them salaries for many months, how do you expect them to look after their families? So those are very important things that we can talk about. Telehealth, we can talk about good care, building equity. People who are providing the services have to be looked after. And it's important for governments, policymakers, and communities to ensure healthcare professionals are provided opportunities and resources to practice their skills. You cannot have a surgeon and he's a consultant surgeon in a hospital and there are no operating rooms. Or if you have equipment, they don't work all the time. You make political statements and order equipments, and the equipments arrive. There are no technicians to manage them and to look after them. When they break down, there are no replacements. These are going to be very frustrating for healthcare professionals. And so, in my opinion, it's an important thing for government the professionals and the communities to work together and give a transparent service for the benefit of all. I believe some of the countries have enough resources. It's just a matter of will and avenues on how to manage them. Again, I am an advocate for telemedicine. Others may not be, but I think it's an instrument whereby we can actually uh, improve the quality of care we provide, improve access to healthcare, and reach out to communities, populations that are not currently being reached, and improve their status. In my opinion, it might be, I don't know whether studies have been done, but I know a number of studies have been reported whereby there are cost savings using telehealth. And I think it's not just in Western countries, but all over the world. You can imagine that in a rural community in Africa where there are no good roads for people to travel, and they have to travel to urban centers to meet specialists, if there's a way a hub can be created in the local community and you have trained healthcare professionals who can build a bridge between the consultation from the urban centers and the distribution of care or delivery of care to the rural communities, that would be a big saving cost for the Ministry of Health. One of the things this could do, even for the politicians, any politician that adopts this telehealth to rural communities might be winning more votes because the people will be able to realize the benefits of telehealth if it is propagated by that group of politicians or community leaders, because they will feel that this is care being brought to their homes and not them traveling to urban centers, spending money, spending time, inconveniencing their relatives that they're going to stay with or paying hotel bills when they, you see. So if I were a politician, I would piggyback into these telehealth projects, encourage them, ensure that they are to see whether they can use it to provide care in a cheaper, affordable way to their communities. But they must have the infrastructure for technology to flourish. They have to have internet, they have to have good bandwidth, and if possible, provide handheld wearable technologies for people as the funds become available. There has to be transparency, there has to be honesty in doing this. But I think this is the way to go.
It's a important point, Dr. Abara, and I want to add a little bit to what you're saying. I think it's important that someone listening to us that isn't very well embedded in medical care or telehealth understand that when you say that telehealth has cost savings, we are not talking about replacing high quality in person healthcare with cheaper, lower quality telehealth care. That is not where the cost savings are coming from. Where the cost savings are coming from is providing timely, appropriate consultations and evaluations for people that don't have a high quality in person a choice, and getting them care faster and getting them care in a way that is overall going to decrease the burden of disease and decrease the cost on the healthcare system. I think it's super important that we make that clear to people. We're not saying let's take great high quality healthcare and replace it with telehealth care. That's not what we're talking about as the cost savings. a lot of people very intuitively can think about the value of telehealth for the patient. And we've spent some time talking about that. It brings specialty care where you don't have specialty care, brings um, different levels of healthcare workers where you don't have those choices. Maybe you only have a community healthcare worker. But I strongly believe there's also an effect on the physician community that we should maybe have start having a conversation about as a physician community. I believe that physicians who do work on an international basis or even a national basis outside of their local ecosystem get a different perspective on medicine than those that only provide care in one place. And I think that perspective, now we're talking about the post COVID era where people are really looking more for the meaning of in medicine and why they went into it and what is this am I more than just a cog in the healthcare system. I think this globalization of healthcare brings us something as a physician community that's not only helpful to the patient, but is empowering to the physician community, and then also has the potential to bring a degree of visibility to the needs of rural communities that can help bring in that healthcare infrastructure. I'd be curious on your opinion of that, Dr. Barra.
Well, I agree completely with your concept and your thoughts. I believe that as healthcare professionals, we have a lot to gain by just opening our minds, our hearts, and our thoughts to technology as they are thrown on us. The first reaction when there's a change is, for people not to want to change. But I have found that, change is something that will continue to change, and we've got to take them as they come. I believe that physicians or healthcare professionals have a lot to learn in terms of it globally. We now know, and we have known, that there are no real boundaries for diseases. The global pandemic did nothing else, has shown us that there are no boundaries. And so, as healthcare professionals, we have to look at our profession in that manner. Telehealth is here. It is something we can use to continue to improve the quality we provide, augment what we do by in person, and also as a personal development, do something for our own self. I believe, just reaching out to people next to your state and seeing the way they live. I know there's a debate in the US about whether the government should retain all the things that they approved during the pandemic or whether they should be go back to status quo. I think, in my opinion, it would be advisable for those things that were allowed for us to contain the pandemic to continue to flourish or even better. And that is something that I believe that a hybrid care where you have telemedicine, telehealth, and in-person would be very good. And there are a number of papers that are probably going to be published or in the realm of publication in terms of interstate licensure. And if the government approves interstate licensure, then any physician, at least in the States, can practice outside his state. And in fact, patients will benefit from it. Think of oncology patients. If they have to travel all the way for all the appointments from one big center to another, even when their state is, well, the state may not be enough to provide the care, but if the physician where they're going to get the care is not licensed to practice in their state, it may be difficult for them to get good care. And so this is something I believe advocacy with governments and policymakers should be upfront now, at least in the US, so that you in the US they can continue the things that were being done during the COVID. But then globally, I think we should be looking at how can we work as a global universe to adopt certain standards of practice that will make healthcare universal. I listened to a podcast by the director of the WHO, I think last night, and I believe the WHO is advocating for universal care to everyone. People should not be denied of care because they're poor, because they come from a poorer country, or they're in a richer country. I think this, if anything, COVID 19 should have been a good lesson for us to learn that we are all victims of these illnesses and there are no boundaries. So I agree with you that telehealth is a good instrument that can help. It is not a panacea, it's not the be all, but there is a role. There's a good role, and it's important for us, physicians and healthcare professionals, to engage in it, practice it, tweak it. If there are ways to improve it, we all have to be there working together to improve it for the benefit of our communities.
And I just want to restate a couple of things that you said are worth embedding in the memory of everybody listening. There are no geographic, political, racial, or cultural barriers when it comes to diseases. Humans are humans, and microbiology and nature sees us all the same. Secondly, interstate licensure. You brought up interstate licensure as an important tool in equity and access. Because, of course, if all the resources or most of the resources are concentrated in one place, then by definition, the system is built to create inequity. So, interstate licensure becomes a very important tool for healthcare equity. And I would go one step further. I know you called for politicians to recognize the lessons of COVID 19. But I think this is the opportunity for healthcare to lead that conversation. I think the roles of a politician don't necessarily make the lessons of COVID 19 feel like lessons to carry forward. For some people, they feel like lessons to leave in the past in order to flourish. But for us in healthcare, we understand that this isn't something of the past. This is a presage of the future, of all the possibilities of the future. And I think this is an opportunity for us as a global community to lead and say what we need is to supersede our boundaries and to realize that all of us are going to thrive or not thrive based on how any of us are treated. What are your thoughts, sir?
Oh, I completely agree with you. And the I think healthcare professionals should be in the lead. And this is why I thought of the advocacy. It's not going to happen without conversation. And it's not going to be like a warring conversation. It has to be an understanding and affable, collaborative manner. And I have a thought that is going through my mind that, people talk about brain drain. And I'm saying we can use technology to reverse the brain drain. I mean, at my age, I may not be able to travel, you know, many distances. But if I'm still alive and healthy and able to interact, I could give my knowledge, I could share my knowledge through technology. However, there has to be a good reception. There has to be a good um, level of collaboration between various parties. It's not one person, it's not one group, but it's all people work, all stakeholders working together transparently, honestly, for the good of the common people. So that's my idea. I mean, it may be theoretical, but I would think that healthcare professionals should be in the leadership of this advocacy. We have to, because the politicians, they may not know. It is important for those of us who are in the field to bring the facts together and hope we have a good listening ears and then a will to do the work. So I agree with you completely.
And Dr. Abara, you were very much involved with training the next generation of physicians who I believe are receptive to this message, and that we can bring something to them that they will be more receptive to, perhaps, than a different generation of physicians, nurses, pharmacists were. And like you said, reverse that brain drain. I think it's more than reversing brain drain, but it's really ballooning our healthcare workforce. So I want to mention a couple things, and maybe you can add or tell me what else. Um, but right now, before the advent of telehealth, there are many reasons why people would not be able to engage in this really important and meaningful work for them. So, people that are retiring or retired are a whole pool of people we can pull back into providing high quality healthcare through telehealth. People with family obligations that keep them from traveling and going outside of their geographic area are a whole group of people we can bring into this conversation and this work. People with financial constraints that keep them from traveling or leaving their jobs for a period of time. People with mobility issues or health issues that mean they have to stay in a close geographic area. A whole pool of healthcare specialists who still carry all the knowledge and skills needed can be mobilized in this telehealth environment to really stretch and augment this crisis of too few healthcare workers. What would you add to that, or maybe even say in response to that, Dr. Barra?
I think I agree. I agree with you completely, and I think it's a matter of um, the policymakers and governments and the colleges considering these opportunities for um, maintaining or improving the quality of care being provided around the world. Various countries may have their challenges, they may have their resources, limitations, but I believe that uh, looking at using telehealth in various aspects could improve things, could create some equity, could help narrow the gaps and improve access to quality healthcare. You just enumerated the various categories of people who, if applied to telehealth, could provide useful services. And it's not just useful services to the community, but it would be some satisfying outcome for individuals themselves and to make them well appreciated within the communities. So I would agree with you that we are in a position where we can use telehealth for transformational in life, business, and particularly in healthcare.
And I forgot healthcare trainees in that list that I just enumerated. And that is a huge group that can also be pulled into this conversation. You have worked in that area. Tell us about that.
One of the papers I presented at the meeting in California was, we have to, if we think that we need to promote equity, how can we ignore the young physicians, the young trainees? They are going to be the future. And in my opinion, before the pandemic, I didn't think there were a number of medical schools that taught or had any curriculum on telehealth. In Northern Ontario School of Medicine, which is called NOSM, is the first medical university in Canada. And one of the principles in the university is social accountability. It's a university for the people, created by the people, for the people, accountable. And one of the things we try to do there is to become innovative and make sure that we're meeting the needs of the community. In 2020, a few weeks after the declaration of the pandemic, we created a curriculum, a telemedicine curriculum, whereby medical students at that time did not have any structured learning opportunities. But we created a curriculum whereby I had six students at various parts of Northern Ontario come to my office, met patients in my office, interviewed the patients. The only thing they didn't do was physical examination, but we were able to get them to practice like what you do in simulation. But it was real encounter with the patients and in teaching them about teleurology office practice. We didn't teach them surgery because we were not doing surgery, but we were, they did physical examination. They were able to interact with the patients in completing the International Prostate Symptom Score, which is a questionnaire and so we had I think we had 4 modules whereby they learned the art of telemedicine or telehealth. They learned the competencies of telemedicine because it's a little bit different when you're in person. It's like if you book somebody for e-video and then at the time the video or bandwidth is poor, you should be able to switch to audio alone. And there are certain things that we expect people to do as they are doing telemedicine. I think it's important for medical students or for undergraduates to be learning these techniques as whether they like it or not is going to be part of their practice as they grow into medicine. So education of our learners is very important in telehealth. It should be established in medical schools. There should be curricula and processes for ensuring that our future healthcare professionals are well educated in terms of telehealth processes, competencies, and skills. And that will even improve things as the young ones who are techie savvy take on the role of healthcare professionals in the future.
Indeed, indeed. So, medical school, telehealth curriculum, residency telehealth curriculum, fellowship telehealth curriculum, very important now in establishing what the learners of today are going to need for their work when they're finished in a very short time, in a few years. Thank you, Dr. Abara. Dr. Abara, how can our audience connect with you if they want to learn more about what you do or perhaps collaborate with you?
Well, I think I share my email address. Email is probably the best thing because also I have a WhatsApp number. Um, my email address is ruppi, ruppi, at rogers.com. And my WhatsApp number is +1 647 549 6167. Um, I can't promise that I'm going to, but I try to answer my emails and I respond to texts, so long as they're not too long. If they're going to be long, please send them by email. But short texts are good. I can always respond almost within 24 hours.
I can confirm that Dr. Abara is responsive by both of those means, as he has been. That's terrific. Dr. Barra, I can only say it's been a pleasure to chat with you. I feel like we could chat for much longer. We have much ideas to share with each other. Thank you so very much for being on the episode today.
And thank you for having me. And please, we like collaboration. We like working with people for common good. And I wish you all a very Merry Christmas and Happy Holidays.
And I thank you for your boundless energy that over your long career, you continue to lean in and do more and look for more ways to make an impact and to do more for more people. I think in an era where a lot of healthcare workers are burnt out, sometimes they think they need to do less. But I think there is a wonderful surprise in doing more of the things that are meaningful to you and actually getting energy out of doing that. And you are an example of that, sir.
Thank you very much. Thank you. Thank you, Kim. Thank you for having me.
If you enjoyed our episode today, please share it with a friend who you think would also enjoy this topic and conversation. Please also leave us a review. We love hearing your ideas and your feedback and are always trying to make this podcast better. If you'd like to be a guest, we are always looking to have conversations with wonderful inspiring people like our guest today, Dr. Abara, you can email us at info@haew.org. And if you'd like to learn more, join us, partner, go to https://haew.org.